This is video 1 for cancer and HIV, otherwise known as the person with a life-threatening disease. There are a lot more life-threatening diseases than cancer and HIV, but as you well know, these are the main ones. So let's give a little bit of a pathological breakdown here for cancer. Cancer is a growth of dysfunctional cells. Normal cells are very, very strong and healthy and grow slowly. Cancer cells are dysfunctional, not healthy, and grow quickly. So that's why metastases can happen so fast. That's also why chemotherapy works, because we've discussed this before. The theory behind chemotherapy is that it'll kill the bad cells before it kills the good cells. So this is how cells divide. In cancer, it is dysfunctional cell replication, all done with mutations of RNA and DNA. I don't want you to get all wrapped up in the pathology of cancer, because that's not what we're studying here. We're studying how a nurse is going to take care of a patient, but I want to just give you the background of it. There are many different kinds of cancer, different treatments for cancer, and I just want to be able to give you an idea of different kinds. Carcinoma is another name for cancer. So a carcinogenic is something that causes a carcinoma, which is cancer. Neoplasm is abnormal growth of tissue, or new formation of tissue. These are just some words you might hear. Hyperplasia, increase in the number of cells in the tissue. Dysplasia means that the cells themselves are dysfunctional. Metastases, you probably all know what that means. That means the cancer has spread to another organ or another site throughout the body. Remission means someone had cancer and then it was gone. Here are two very important words to know. Benign's a good word. Malignant, not such a good word when it comes to cancer. Benign means it's very slow growing or not growing at all. Might be encapsulated, localized, no recurrence, and there's a great prognosis for a benign tumor. Malignant, not so much. Grows rapidly, rarely enclosed, it spreads, very harmful, and the prognosis can vary because we can treat malignant cancer. It's just not as easy. Anatomic classification. When you get into staging cancer, there is a whole bunch involved, but there's also some very basic things. You can have stage 1, 2, 3, or 4. The lower the stage, the more likely that your prognosis will be a healthy one. So we really do want to push for healthy people, so we want to go stage 1 or less. Again, sorry for that little delay. Stage 1 is our best bet. Stage 2, we can work with that. Stage 3 and 4, you're getting into some pretty serious stuff. So here is a very, very brief look at staging. Let me see if I can make this. The slide's not really. There you go. So you can see it better. Stage 1, little tiny tumor right there. Let's go just click it out. Stage 2, cancer has grown through the muscle, so it went through the colon and it's eking out just a little bit, but we can still pretty much remove that area and be okay. Stage 3, it went into the lymph system. Remember, the lymph system is the trash can of the body, or I should say the garbage disposal system of the body. The liver is more the trash can. And that lymph system is really efficient. So it comes in and it's like, oh, hello, garbage. Let me pick you up and maybe I'll drop you off in the lungs. All right, here you are in the lungs. And look, now we have stage 4. Not as good of a prognosis. So I just made that all extremely simple for you, but it's okay to be simple because you don't have to think of the deep pathology. That's not what we're here for. Tumor size is also very important, and this slide will help you with that. Looking at these, for some reason I can't get the video screen adjusted appropriately to see the whole slide, so I'm sorry for that. But you have your printed copy of that, and this is just good information for you. The invasion of cancer is what causes the pain. The cancer itself, the actual cancer cells, do not cause pain. It's just when they push on other parts of the body, that's where pain can occur. Metastases, again, is how cancer spreads. Roots of metastases: seeding, transplantation, lymphatic spread, hematogenesis spread. In other words, any way that it can transfer, it will. The immune system plays a huge role in cancer because we can fight off a lot of disease processes, including cancer, if we're healthy, if we eat healthy, and we don't have anything bad in our body to feed the cancer. That's how cancer wins. So obviously, we want to eat healthy. We want to encourage our patients to have healthy lifestyles. So simple things like staying out of the sun and eating broccoli make a huge difference in cancer. I know that sounds silly, but it's the truth. There are different groups of cancer. Carcinoma means cancer. Sarcoma, leukemia, lymphoma, malignant melanoma, glioma, brain tumor, and there's many, many, many more. They can hit different parts of the body depending on their name. And obviously their names are pretty, make it easy to describe what they are. Carcinoma rises from epithelial cells, squamous or basal cells, and adenocarcinoma. It's the most common type of lung cancer. Squamous cells can affect the skin and mucous membranes. Adenocarcinoma affects glands, and you can see all of these different cancers as you move through. Sarcoma is connective tissue that becomes cancerous, can include bone and muscle. Osteosarcoma is obviously bone. Liposarcoma is a connective tissue, and Kaposi's sarcoma has to deal with organs and vital organs and connective tissue. Leukemia is a blood-forming tissue, starts in the bone marrow and the spleen. It's a malignant disease of the bone marrow. RBCs and platelets are affected. There's whacked out abnormal white blood cells. Don't know what causes it. They believe that there's a genetic component to it, as well as viral, environmental, radiation. I have a friend who is recovering from chronic myelogenous leukemia, and there is all kinds of research on her kind of leukemia that they think it is connected to parents, specifically fathers, who were in Vietnam and exposed to Agent Orange. So I think that's extremely sad, but very interesting. As you read through, you can read about leukemia, the different kinds, how it happens. And again, this is all very pathological. If you look at this slide, you'll see anemia, which is low iron, right? Neutropenia, that means there's no functional white blood cell. Thrombocytopenia, that means there's too many red blood cells and they're dysfunctional. Then you get to lymphoma, which originates in the lymphatic tissue. There's Hodgkin's and non-Hodgkin's lymphoma, and these either originate or are propagated by the spleen, the lymph nodes, and the thymus gland. Malignant melanoma, we're all too familiar with that, which is a skin cancer. It can show up in many different forms. Treated quickly, patients have a good chance of survival. Left and ignored, melanoma is not curable. Biggest thing about melanoma is to stay out of the sun. Host susceptibility, I don't want you to get too much into that because that goes so into the immune system, to what happens when there's a weakness in the immune system. But this is where you get into things like how smoking affects cancer. Those kind of things have to do with host susceptibility. The weaker the host, the more likely it's going to be invaded. Just like in your home, you leave the doors and windows unlocked, somebody might come in and steal your radio. Early detection for any kind of cancer is the best for successful treatment. Always educate people, especially with melanoma, to check their skin to stay out of the sun. Have regular physical checkups, and watch for any changes in their body. And there's a great acronym on this slide. I love this slide. For some reason, like I said, the screen doesn't want to show the whole thing, but let me see if I can make it. There you go. 7 warning signals for cancer. Change in bowel or bladder habits. All of a sudden you have diarrhea. All of a sudden you're constipated, have abdominal pain. You can feel a lump in your abdomen. A, for caution, sore that does not heal. U, unusual bleeding or discharge. That can be from the nose, the vagina, the rectum, the bladder. T is thickening or a lump in the breast or elsewhere. Can you actually feel a growth somewhere? I is indigestion or difficulty swallowing. This will be prevalent if the patient has stomach cancer or esophageal cancer. O is obvious change in a wart or a mole. There you're looking for skin cancer. And N is a nagging cough or hoarseness. And then you're looking at, of course, lung cancer. In order to have a good truthful, accurate diagnosis, there has to be a biopsy. And this is where they remove a portion of the tissue or the tumor. Sometimes if it's incisional, they just remove a portion. If it's excisional, they remove the entire thing. They can do this as surgical procedures. They can also do needle biopsies. And that will, if they do a bone marrow biopsy, they can look at the size and shape of the RBCs and the white blood cells. And it's very successful for diagnosing leukemia, multiple myeloma. Other biopsies that they can do with a needle are breast biopsies, liver, lung, pleural cavity. And what we're going to do, obviously, with the patient is control pain, keep the field sterile. A lot of times they do these kind of biopsies at the bedside. And then we want to watch for bleeding, swelling, or anything abnormal following the procedure. The next few slides from let's see, I'm trying to read the very tiny numbers. Slide 26, or I think we're on 28. Let's skip all the way over to slide, let me see where I want to go. I want to go all the way down to slide, I think it's 46. Now, that doesn't mean I don't want you to cover them. I just am the information that's already on the slide and the notes will be helpful enough. Please make sure you handle those slides. Read them, study them, obviously compare them to your notes in your book. But I'm going to skip on now to slide 46 and we're going to talk about chemotherapy. When you're taking care of patients who have cancer, one of the big things and what requires a lot of nursing care is chemotherapy. As I've told you before in class, if we called antibiotics chemotherapy, we'd all be a lot more afraid of them than we are, but they are basically poisons that we put in the body with the intention that the poison will kill the weak cancer cells faster than it will kill the healthy primary cells. So there's all kinds of different chemotherapies and they all work in different ways, but mostly they work by either starving the cell to death or stopping the cell from being able to reproduce. So this is it for video number 1 on cancer and HIV. So we'll start with chemotherapy again on video 2.